please tell us your name and title?
Hi, my name is Thuy Nguyen. My title is Chief Medical Officer at Southland Integrated Service.
What are the unique challenges you face as a healthcare provider, or in your case, a doctor, in getting patients to access healthcare in this specific region?
As you know, in the community, the challenges that we have is majority of the time, the patients, they have no coverage. Majority of them is uninsured, underserved, and they're very vulnerable. So the challenge is getting them to our clinic and finding resource for them. And although we do have some changes throughout the years as far as their health services, but there's still challenges because sometimes they don't know the importance of coming in or preventive care or just a regular checkup. So the challenges would be not knowing where to go for them, and when they do come, by that time their health is already severe, like high blood pressure or high blood sugar, or services that they don't know that exist in our community. Yes.
Can you talk about delivering high quality care to your patient population?
Yes. One of the things that as a family doctor, and I've been working in the community for a while, for 10 plus years, I see the importance of the patient quality is that we want to, even though, because we do serve the underserved, the uninsured and the vulnerable, we want to give them the quality, because when they come, that's the only time they do come. So we try the best to make sure that we give them the right information, make sure that we try to do everything at one visit rather than, come back again because we may not see them. So the quality that we do serve for them is mainly make sure they do know where to get their medication, follow up for labs, so things that go a little bit beyond for the regular patient. If they able to come back, it's easy, but we know by talking to them, we know that sometimes they're very hard to come back. So the quality would be make sure that we give them the right tools, the right information for them to follow up. Yes.
And how do you guys collaborate and collectively work to ensure successful care?
The work that we do here in our community, especially our clinic, is like I was sharing, is that make sure that we have the right information for the patient to give them the like if they need medication, we'll make sure that they go to the right pharmacy, especially if they have no coverage, that they do get the medications. We do have sometimes help them make an appointment if they have trouble making an appointment. So the make sure that collaborate with other, if they're doctor visit, that make sure they do go to the doctor visits.
Can you name one example of an advocacy effort that has succeeded and why? The most recent that I can recall recently is that we have a patient that she does have the coverage. It just she needed the surgery for her medical condition, and she has a hard time making an appointment for the specialist. So myself and of course my team, which is one of my staff that work very closely with me, so she called to the, especially is actually the UCI doctor that she needs to be seen. So it would just try to collaborate with the UCI doctors and making that appointment for her. And at the same time, there was some difficulty of getting this surgery approved. So then we take time, we try to communicate to make sure that she has all the information, make sure all the referral, and just go back and forth. So finally, they did approve for the surgery. So we're very happy, because if not, then it's gonna go on more. And as you know, the patient sometimes when they see that it's so hard, they give up. So for us, we want to make sure that they do know the importance of follow-up and things like that. So that's one of the latest success, is that we were able to help her get through the specialist and making sure that she have the care that she needs. And it was just mainly it was very good for the I guess for the specialist to kind of like continue making sure that she get the care rather than, oh well, they cannot do anything. So we were very happy. Yeah, it's a good story.
Yes.
What are the challenges posed by constantly having to advocate for funding, despite consistently demonstrating value?
as you know, the challenge that we have is that sometimes patients, they do have their coverage, but it just getting to the more services for them, like transportation. Sometimes they do go to the specialist that doesn't speak their language, so trying to get the interpreter. So the funding here is for me, is mainly the transportation, that for them, to help them, and then making sure that they know the importance to follow up with their specialist. Yeah.
How do you feel the community perceives your organization?
My community is perceived. Well, we've been in the community for the organization been in the community for almost 40 years, but our clinic has been with our community for almost 20 plus years. So they do know that we have the service for them. It was just as you know, we're in Garden Grove, so most of our Vietnamese populations, or the main that we serve, is in a little more down in the little Saigon, Windsor. So it's a little harder for them to go all the way out here. But then we do serve different patients. So now that we see more of diverse of patients, so they do come to see us. So I think that we try to tell the community that come as much as they need to for us to serve them. Yes.
So what is your job, and why do you do what you do?
What do? I need a job. That's why. My job is, I am been in the community for since 2002. So I've been here for a long time. So my job is to make sure, as a family doctor, my job here is to make sure that my patient get the quality care, and the main thing that I want to share is the preventive care that they should have. Yearly checkup, preventive care, the things that they need, vaccination for the children, and the women's health, and the overall checkup for the patients. Yeah, so my role is to make sure that patients get the care that they need.
Do we need to redo that because of the ring?
So what was that ringing on? Was that a phone or something?
This one's fine. Yeah, so should we do that one?
Yeah.
Sorry.
Okay, that's okay. Oh.
Can you ask that question again?
Yeah,
I'm sorry.
yeah, I will. So what is your job, and why do you do what you do?
Okay. My job is mainly, I'm a family doctor. I've been in the community since 2002, so I can say that I have learned a few things or two about the community needs. So as time, I see the changes in the different coverage and things like that. But my main job is to make sure my patient get the care that they need. They do go check up yearly, the preventive care. We talk about vaccination for the children, the women's health, and the overall checkup. And now, of course, we work on chronic disease with diabetes, hypertension. So pretty much, I'm here because I've been here the longest. So I have the full time. So my job is mainly to overlook everything, to make sure that everything's run for the clinic, for the patients, and overall help the communities.
Can you recall any special patient wins or stories? If so, comment on them.
Again, my most recent patient that I feel that to me is a success. She came to me as a new patient. She's in her 40s, young, but she came and she was very weak. She has a lot of pain and was very worried because she has weight loss. And of course, she has also diabetes. So, she have seen other physicians, and it was just somehow they haven't got an opportunity to see her or talk to her because she's go to multiple specialists. So what I did, or we did here, is that we saw her and we spent time, extra 5 or 10 minutes, trying to understand what is it that she really need, to make sure that she knows that this is what we need to do. So mainly try to give her like a information, try to share with her, this is what the plan. Okay, this is what you have, this is what we're gonna do. And then I have her come back within a week or two. So by having her come back every 2 weeks, it seemed like I can understand her more, and I can see where is her needs, and then I can ask her, this is what you need to do. So once you gain their trust and they see that you do care for them, so after a month she's gained some weight, she looked much happier, and she's able to kind of like relax, not as anxious as she first came. So that was one of the things that came to my mind was, that one patient that I think that by talking to them, listening to them, and see where their needs, because everybody can just write prescription, give them the lab, but if you don't know where they're coming from, then they go home, they would know why they need to do. So that's one of my thing that I learned. It was that once you understand what is it that the underlying reason why everything happened, meaning they're worried, they're short of breath, or the things that they cannot, they worry too much, then you answer those, the uncertainty, and then they feel that, okay, now they know what to do. Yes.
Sounds like something my mom says.
Yes.
Yeah. So what is unique about the community you serve? And this is the last question.
Okay. Right now the uniqueness that I do see is that because they have been with us for years and years, or my patient, so they do know our style, they do know that we care. So the uniqueness is that they come and they share their story, and vice versa. Sometimes I learn a lot from my community. I learn from other communities, because sometimes, working full-time, sometimes you get a chance to go a lot. So you hear their stories, you hear what their challenges, and you hear that they go back, to visit their homeland, and then it's just different story, and it's unique because each individual patient, their own unique. So for me, it's learning my own, heritage, my own culture. At the same time, I learn others. So I gain a lot by helping the patients.
That's it. Cut.
Cut.